The Alliance brings together a comprehensive partnership all across healthcare services, social care, local government and the voluntary sector. Ashford and St Peter's Hospitals, Surrey and Borders, CSH Surrey, NICS our GP Federation, Woking and Sandbere Hospice, our borough councils across Woking, Spelthorne, Runnymede and Elmbridge, and Surrey County Council and our social care colleagues.
Coming together of different organisations to consider how we can provide better health and care outcomes for the people that live within our community.
Partnership working for us is so important in terms of delivering the right services for working residents.
Our work with the Alliance has strengthened ties between this council, the NHS and neighbourhood and neighbouring authorities. And we have learned from each other, providing our residents with improved healthcare.
Runnymede Borough Council has always held the ambition to support its residents with their health and wellbeing. However, it's the formation of the Alliance that really has given the chance for partners to come together to have a shared goal and objective in order to provide the best possible outcomes for residents.
We enable communities to stay healthier and people to stay healthier for longer, but also bring the services together so that when they do have problems, they're far more integrated.
It's a real opportunity for health and care to work collaboratively together for the benefits of our residents, working in a way that enables residents to tell their story once to the professional that's looking after them without having to duplicate and tell their story multiple times.
The Alliance is already doing some amazing work. We're bringing physiotherapy services out into local leisure centres and into local communities. We're revolutionising dermatology services, bringing in new technology and artificial intelligence to give people quicker access to cancer care.
We have a new AI version of the Photo Hub now, which we've been running for about 3 weeks, and we use a platform called Skin Analytics. So the new system means that when the GP makes a referral, they can opt to have the patient come to the Photo Hub. The patient comes into us within 2 working days. We take a series of images that are uploaded, and the patient is then triaged on the basis of those images. They are looking at those patient cases on the same day, and they're turning them around the same day, which is phenomenal, really.
The step-down service came about because Spelthorne Borough Council had identified that there was a need to support the hospital. So whilst working with partners and coming together with the Alliance, they decided to look at an option where there was a temporary accommodation for people who were remaining in hospital for extended periods of time because their home or their destination was not suitable to be able to meet their current needs.
It was a lifeline, just as literally for him to go somewhere, be able to be by himself. It's a nice place to be, to set you off, get into your own home again.
I'm more than happy to be here. I think this was ideal, my situation at the time.
And what we're really passionate about is tackling some of the most significant inequalities and the wider determinants of health outcomes in our communities. So working with local government, local businesses, different community groups to think about how we improve education, economic prospects, work and employment, the environment and the areas in which we live. One of the most significant impacts of the Alliance is on our staff and on our people.
How staff can learn from colleagues in the district and borough councils, can work with GPs, can work with our community health provider.
For our teams, I think it will be an excellent way of actually bringing us together and looking at how we work more cross-functionally, actually learning from each other and possibly even swapping roles so we get greater experience. So I think it's a huge opportunity both for our citizens and for the people working right across the whole of the Alliance.
So what does the Alliance mean to you and your family? Well, we aim to deliver much more integrated, joined up services, providing the right support at the right time. We bring together a different mixture of expertise all across organisations that allow us to provide much more complex care and much more responsive assistance for people.
We're able to give you the care that you need in a local facility that is agile and provides the care that you need when you need it.
And we'll aim to make things easier to access with simpler ways to book an appointment without bouncing between organisations and different services. So the Alliance is an incredibly exciting opportunity to deliver more value to local people, to improve outcomes for you and your family, and to deliver benefits and new opportunities for our staff all across the partnership.